The training opened in January 1996. Here, students from the various educational programs offered by the Faculty of Health Sciences complete 2 weeks of a compulsory period involving training in live conditions with real patients.
The students practice teamwork and their own professional role, and they observe and learn about the other students' professions. Multi-professional education is one of the most important pedagogical principles of the Faculty of Health Sciences.
All the students from the various programs study sections jointly, starting from the first semester with a 9-point course for all. Towards the end of the studies, students from some of the programs will carry out joint clinical training. This takes place at the Unik training ward at the University Hospital, as well as at real primary healthcare units. Human communication skills are included from the first semester. All the educational programs make use of a teaching method known as PBL, or problem-based learning.
The training ward is a separate ward of the Department of Orthopedic Surgery. Patients with hip fractures are the most common patient here. They are old, they need treatment, care and rehabilitation. There are important tasks for every student.
In the training ward, students form 3 teams and will in practice run the ward, doing everything from rounds, prescribing medication and other treatments, to initiating patient rehabilitation.
The students work in multidisciplinary teams. One team consists of 1 to 2 medical students, 3 to 4 nursing students, 1 occupational therapy student and 1 physiotherapy student. All teams work after the same timetable as the permanent staff.
The students will handle job-related tasks as well as sharing responsibility for the personal care of patients and the running of the ward. An experienced doctor or nurse is always on hand. The ward's permanent staff has a demanding task, and the interaction with the students is intense. Both medically and from a medical care point of view, the staff is experienced to guide the students in a variety of practical areas. The staff must also be able to solve a range of problems more theoretical in character and make correct decisions regarding the care and rehabilitation of patients.
One of the tutor's most important pedagogic tasks is not to give the answer to the students. The students themselves should sit down and discuss and come to a reasonable conclusion. To tutor is to have your hands behind your back.
Here, the ward doctor has a very special role. It's the doctor's job to confirm the suggestions given by the care team and only play a minor part in the process leading up to them.
The problem-based learning has given the students experiences of discussions and teamwork. This knowledge makes it easier for them to work in team, and during these 2 weeks the teamwork becomes even better.
During the morning rounds, each patient is discussed, and each member of the care team contributes with their knowledge about the patient. The team leaders observe how well the students cooperate.
The students' own ability to contribute to the treatment, care and rehabilitation is obvious.
Discussing the patient at the sitting round in the morning is important to the understanding of the patient's problem. The medical issues and the technicalities surrounding rehabilitation are discussed in detail. The students generally handle this on their own, and the team leaders will act as observers.
The students give proposal how we treat the patients here on the ward. In the beginning we notice that it's quite difficult for them. At the end we notice it's much easier. The formal responsibilities for these decisions taken lies, of course, on the professional staff.
Good teamwork is established quickly, and by the second week, things begin to run smoothly. The general attitude of the students toward their time at the training ward determines how well the care team will operate. The positive attitude which is most often found here leads to valuable experiences.
Well, I get to see the patient from the day he or she is admitted until the day he or she leaves. And during this time, I get a chance to see what a nurse do or what a physical therapist do.
It's been lots of fun really to meet new people and other students from other programs and see what they do, and you meet them in a different way than you usually do.
And I also get a chance to learn how to work in a team. And during this time I have a support in my supervisor, who is a real doctor.
The students become aware of the problems the patient may meet in connection with the operation and the later rehabilitation. They will also learn which contact they need to take with their colleagues in primary health care and in the community.
An overall view of the whole process is important. It's vital for the students to have the opportunity to follow a patient through the entire care process following a fracture, from an operation and post-op care through to rehabilitation. At the evaluation, the students contribute viewpoints and constructive suggestions to improving the ward.
Sometimes it's you feel a little bit divided because you do both like nursing care and doctor's work, and you can feel a bit confused about that, and sometimes the patient too maybe, but it's been really fun anyway and you've learned a lot.
Some participants experience a conflict of roles in having to divide attention between job-specific tasks and general care duties.
The number of medical complications on the training ward is not higher than on a regular orthopedic ward.
The patients appreciate the stay at the ward thanks to the enthusiasm and concern shown by the students.
The patient who needs a second operation always want to return to the ward.
It's a great advantage for the students to work with real patients. The work to seek information about the whole patient is a very important experience.
The student has a clear understanding as to how complicated it can be to obtain a complete picture of the patient.
Up till now, we have educated about 2,000 students from different disciplines, and they have treated more than 1,000 patients.
The many years of multi-professional training in a ward environment is a valuable contribution to modern health and medical care education.
There are high demands on the tutors' competence and enthusiasm. The patients are satisfied. Many students consider this placement the most important part of their program.
I think it's very nice. It's a social thing. I get to meet a lot of people in my own age.
Other universities have shown great interest, and several similar wards have started or are in the process of starting up in Sweden and abroad. The Faculty of Health Sciences in Linköping also runs multi-professional education at 2 primary healthcare centers, and new units for different medical specialties, including local healthcare centers, are planned.